Okay, so we're just gone past 1 o'clock UK time, so I think we can make a start. Thanks everyone for coming along to our penultimate session of the Atwine Festival for this year. I'm very pleased to welcome Maaya, and can I remind you the session is being recorded, so if you do not want to appear in the recording, please have your cameras off. Pass over to you, Maaya. Thank you.
Thank you, Frances. And hi, everyone. I am delighted to be here today. Thank you very much for joining me for this session. I think this conference, this festival, was one of the first I ever presented at, so it holds a very special place in my heart. And I'm very excited to be talking to you today about creative health. So I'll just head over to my slideshow now. Okay, perfect. Brilliant. So today's talk that I'll be sharing with you, I don't know where that's gone. I'm so sorry, I just pressed something. Let me just find it again. So my intention really today is actually to learn more from you than to be teaching about creative health. And I would love to learn from you and discuss with you in today's session, how do we teach creative health in an innovative way? So my name is Maaya Modha-Patel. I'm a pharmacist. I have a master's in creative writing and a master's in creative health that I've just finished. I'll be graduating from that next month. Yay! I'm also an academic. I've been an academic for about a decade or so. I hold a fellowship of the Higher Education Academy, and my current role is at Queen Mary University of London, where I'm a senior lecturer in communication and professional skills teaching medical students. And this has brought me to that idea of being able to fuse something I love, the creative health, with something I do, the teaching of the medical students. And again, I just love to hear a bit more about your experiences. So let me talk to you about today's agenda, and then we can get started. We'll begin with an introduction where we just get everybody on the same page in terms of creative health and its background. We'll spend a bit of time thinking about why teach creative health, and I'll talk to you a bit about the literature and what that says. We will then move on to a case study. I'll give you a brief overview of some teaching in this area that I've piloted and some of the results from the research I conducted. But I'd like most of the session, hopefully, to be spent on an interactive activity and a subsequent discussion related to this, and then we'll close the session. All right, so let's get started. Creative health. There is no definition, no single definition for creative health across the literature. Instead, it's a term that's used to encompass the positive impact of non-medical and largely arts-based interventions on human health and well-being. And so it's really interesting in that there's no single definition, but it is something that's been widely adopted. And in the UK, we have an all-party parliamentary group on arts, health and well-being, and they are championing this within the healthcare space. And they've actually given a little bit more detail in terms of what the arts refer to in this definition that I've shared above. And they've said it refers to the visual and performing arts, crafts, dance, film, literature, music, singing, gardening, and the culinary arts. So very broad. When we first might think of the term arts-based intervention, we might think picking up a paintbrush or a pencil, but we might not think of crafts, gardening, cooking. So we can see that creative health really encompasses quite a lot in its in the umbrella of its term. And it has also been used across a number of different studies and papers to include indigenous practices, practices that have been used for centuries as part of a community's traditions when tending to illness. So that can include things like yoga, meditation, that we know are commonly used in the East and have more recently been used in the West. And those are rooted in the cultural traditions of the countries from which they're from. So for example, yoga rooted in Hindu traditions, meditation, mindfulness rooted in Buddhist traditions. So again, creative health being quite a big term to be able to incorporate all of these different interventions and activities. And so in that way, by supporting and championing indigenous practices, creative health supports community mobilization for the purposes of health improvement. And what I mean by that is, it's essentially saying there may be practices that communities may have used based on their traditions, their values, their history, for the purposes of improving their health. And creative health is a way to give that a name, a term, and make it acceptable, to quote unquote acceptable. But it also then in that same way addresses the long-established history of inequalities within healthcare resulting from colonization. We know that there was an imposition of a particular biomedical model on a number of different communities and practices when Western countries colonized Eastern countries. And in that way, it could be the case, and it probably is, that we've lost a number of different indigenous practices to history, because we've said, this is the practice of medicine, this is how we follow it, this is how we look at symptoms and we help you get better, and this is our conventional way of treating illness. And so creative health now gives a voice to some of those long-held community practices, indigenous practices, and allows them to become more openly spoken about. An interesting point raised by the Department of Health and the Arts Council is that the arts make a significant contribution to improving the lives, health, and well-being of patients, service users, and carers, as well as those who work in health and the arts. So again, it's encompassing a number of different people here, people on a medical journey, either individually as patients or service users, or as their carers, as well as those who work in the health and the arts themselves. And so to come to you all then with my first little bit of interaction for this session, I would love you to take part in a Menti. And if you're happy to, can you share a creative health activity or intervention that you participate in actively now, or maybe you've done in the past? And how does it make you feel, or how has it made you feel? So the Menti details are here on the screen. Probably the simplest way would be just to join at menti.com with that code 78757713. And I'll stop sharing now and just pop that link in the chat for you as well. Let me do that for you now. Okay, so that link to the Menti is in the chat. And I'll just get the Menti screen up so we can see what we all think and what we've all shared. Okay, and feel free again to share a number of different creative health interventions and activities within this. Let me go back to this one that you might be participating in. Anything that you might do, like we said, arts-based, but also things like gardening, singing, yoga, cooking. Thank you. Brilliant to see a number of these coming up. Just give everyone a few more seconds to add some of their interventions. This is great. In fact, so many here: knitting, creative writing, drawing and painting, yoga and Pilates, art therapy, mindfulness, meditation, spoken word events. How exciting. Brilliant. So I have a wonderfully creative group of academics who have joined me today. Thank you so much for sharing that. Perfect. I will move on now to the next slide, reading books as well in here. Thank you. Brilliant. Thank you. Jigsaw. Love it. Love a good jigsaw. And then I asked you, how does this creative health intervention make you feel? And you have added things like happy, relaxed. Oh, I like liberated. That's really nice. That's touched me quite deeply. Liberated. Productive, peaceful. I think we've got a couple of activities in here as well, things like flower arranging, lovely. Wonderful, calm, healthy. Somebody's put nervous as well in here. I guess sometimes when we're taking part in something new, we can feel a little bit nervous. I'm finding the bigger word though that's kind of coming up is relaxed on this word cloud, and happy, focused. Wonderful. Manage pain. I think that's a really interesting one too, and that links back in with it being a creative health intervention. Brilliant. Grounded. Wonderful. Thank you. Thank you all so much. Thank you. I'm so appreciative. I will stop sharing and then return to the presentation now. Thank you again for taking part in that with me. Okay. Okay. So much like you, it's worth thinking, much like everything you all shared with me, it's worth thinking about what the benefits are of creative health to patients. And many of you may have put down how you were feeling as somebody, as a service user, essentially, of that creative health intervention. And that's going to be echoed in some of the findings that I share with you across the literature as to the benefits to patients of creative health interventions. One of the biggest benefits that comes up time and time again is the fact that patients have reported creative health interventions humanize their medical journey through providing them with an outlet to reduce stress, but also a way to feel seen and heard. So it can be the case quite often that patients feel like passive recipients of medication, treatment, advice during their journey. And a creative health intervention then gives them a little bit more autonomy, gives them an opportunity to express themselves, to feel seen and heard, like they are present during that journey, rather than things just being done to them. Another benefit is it can impact the relationship that healthcare professionals have with their patients through building more trust. If healthcare professionals are more aware of creative health as a discipline, as an area of medicine, then there's no risk to patients of sharing some of these creative health interventions they're taking part in. There's no risk of judgment or feeling dismissed or feeling belittled for doing something that might not be within the scope of what we call conventional medicine. And so there's that trust now, that openness, where a patient feels they can speak to a doctor to say, I've actually been doing this or taking this alongside what I've been prescribed, or I've actually not been taking what I've been prescribed and I've been doing this instead. And that, again, is going to build the trust and rapport that a patient and a doctor have with each other, and a patient and any other medical professional too, thinking about my practice as a pharmacist, nurses in hospital or in primary care, etc. And following on from that, then, patients have the option, if they would like, to receive a medical professional's evidence-based perspective on the treatment discussed. I'll talk a little bit more about how I supported my medical students to develop this evidence-based perspective later on. But essentially, by speaking to a medical professional about something that's, like I mentioned, not considered within the scope of conventional medicine, it gives the professional an opportunity to listen, first of all, and understand why this patient may have elected to take this route, choose this intervention, take this alternative therapy. And if there is evidence-based literature, studies around the efficacy of this medicine or this intervention, the healthcare professional can access them and discuss them openly with the patient. I think that leads to more of a partnership. Again, moving away from that paternalistic approach of the doctor tells you what to do, and more of a patient-centered partnership, where the medical professional can then do their own independent research and come to the patient to say, actually, there is good benefits. I just wasn't aware of this being used alongside this, so continue. Or I've actually found something in the data that I have to discuss with you. I'm a bit concerned about this. And so that can really open that relationship up and lend itself to more of a partnership. It can also, for the patients as well themselves, provide social support, which has been shown to improve outcomes, because quite a lot of these arts-based interventions are done in groups. So group-based physical activities, group-based arts activities. So it's really nice to be around people who may be empathetic, maybe understanding, maybe going through the same, the same experiences, same emotions that you might be going through. So that's a good list of the benefits to patients that's documented in the literature. Moving on then to the benefits to healthcare students and professionals for teaching creative health. It would give healthcare students and professionals a greater awareness of the range of treatments available to patients, and that would be in terms of teaching, but also then when they're on the front line and they're meeting patients, they are now more open and aware of what patients might be taking, what interventions they may be practicing. And it would give then a healthcare professional a better understanding of that individualized care, the personalized care that we want to be championing in the NHS, of a patient's particular preference and the way that they wish to approach treatment of their presenting medical issue. So if a patient is the type of patient who does pick up a paintbrush when they're feeling overwhelmed in everyday life and has now received a diagnosis and feels like painting a mural, being able to discuss that with their healthcare professional is actually a really lovely insight into who they are as a person, and it builds that better understanding in the healthcare professional as well of this patient and how they're doing. And it lends itself again to a more personable human relationship rather than just this is a formal healthcare setting and a formal healthcare relationship. It provides the healthcare student and the healthcare professional with an opportunity to reflect on their own culture, preferences, and their approach to health and self-care. How do they meet issues, obstacles when they arise? Do they go to a creative health intervention? Do they want to start doing something like this? Is there something in their culture that they grew up with as a home remedy, but they've rejected because up until now it hasn't been within the class of what we consider conventional medicine? But now they're more open to thinking about those home remedies, and actually, could there be value to taking some of these when they're feeling unwell because they did it when they were younger and now they can try again? And it also then can support some of these healthcare students and professionals with this idea of flourishing and thriving in their own environment, because they're building up a more holistic picture of themselves as well as their patients. I found a really interesting article that talked about how creative health and speaking openly about creative health practices with patients gives healthcare professionals and students an opportunity to gain more knowledge about these different and diverse practices, which can improve and innovate care pathways. If something's being done and it's being done to good efficacy in a number of patients that this healthcare professional is serving, then why can't we look into it and conduct a bit more research and potentially integrate it into our care pathways? And finally, ultimately, I think it's brilliant that teaching creative health and having a greater knowledge of creative health would ultimately facilitate a more patient-centered and holistic approach to consultations. Okay, so important for us to recognize that medicine is brilliant in supporting us to feel better and improve health and well-being, but it does have certain limits. So here we've found a quote that says, despite medicine having a firm base in the biological sciences, enormous technological resources at its command, and a record of astonishing achievement in elucidating mechanisms of disease and devising new treatments, it is in crisis. And this is evidenced by increasing numbers of patients declining conventional medical treatments and electing to use alternative, complementary, or other non-medical therapies instead. So what we're finding is record numbers of patients are turning away from the traditional biomedical model of going in for a consultation, being seen as essentially a set of different symptoms and being given medications to treat those symptoms. And what patients are looking for now is that more holistic approach, being seen as a person, trying to support mental health with some of these creative health interventions that they feel really appeal to them and help them alongside perhaps a conventional therapy, or maybe before starting a conventional therapy. And so this move away then is, it should be, and hopefully is, prompting medicine and the teaching of medicine to start including considerations of creative health interventions within its curricula, so that there's an understanding within students who graduate and ultimately become healthcare professionals in practice of these different interventions, practices that patients will be seeking when they go and meet them in practice. So the case study I wanted to talk you through, which I piloted when I was at King's College London, was related to creative health. I offered students a scholarly project, medical students in year 3, when I was working at King's College London in 2023. So this scholarly project module, that's what the SPM stands for, involved third-year medical students selecting a creative practice and conducting scholarly research into the evidence base that supports its use in the treatment of a known medical condition. So I gave the students, my little group, complete onus and autonomy over whatever creative practice they wanted to select, and look into the evidence behind how it's been supportive of patients with symptoms that are associated with a known medical condition. I had 6 students who self-selected this project, and they were working under my guidance 1 day a week over a 12-week period. This is a bit wordy here, so I'll break it down. Essentially, as I said, I allowed students to go away and think about what they would like to research in terms of a creative practice and a condition. They then followed the PRISMA process to identify published literature about the impact of a broad range of creative practices and non-medical treatments on human health. And some of the areas that they chose, one student explored the effect of transcendental meditation on the management of hypertension. Another student was looking at the role of music therapy in improving the clinical outcomes for stroke patients. And another student in the group wanted to look into Ayurveda, so look specifically into the use of Terminalia original in the prevention of cardiovascular disease. Students were expected to gather evidence, so do this independent research themselves, and then conduct a critical appraisal of the research they gathered and the findings before designing a pilot study for the UK population based on their chosen intervention and that was part of their assessment task. So this is the module itself, and this is what I set students the task of doing, and this is the journey sort of they followed during that module. So after the module, then I asked students to take part, if they were willing to take part in some semi-structured interviews, of which 5 out of the 6 did. And I was trying to evaluate the impact of the module on student knowledge of creative health. Following these interviews, I analysed the data that students were able to share with me using reflexive thematic analysis, reflexive TA. And so I generated some themes. One theme related to general experience of the project was feelings. Students had mixed feelings about conducting a project in this area, but largely positive. Quite a few students said they found it really eye-opening, really interesting to do something like this during their medical course. Students also really appreciated the knowledge gained and appreciated working within a group. I had a number of different sessions with students throughout the 12-week period where I asked them to present their findings. So nothing fully sort of perfect in any way, just where they'd got up to with their research. And they presented it to their peers in their group of 6. So it was really interesting for example, the student who did research into stroke treatment with music therapy to present her research to the student who did the deep dive into Ayurveda, and for them to learn from each other. And that's what students referred to when they mentioned appreciated working within a group. So learning to take to future practice, which was what I was really interested in. 2 themes were generated from this: how students' creative health research has affected their individual approach towards patients, and how the impact of this research has played a part on their professional medical practice and development. So within the theme of approach towards patients, there were 4 sub-themes, and I could spend so much time going through this with you, but I know I'm mindful of the time that we have. But the main sub-theme I wanted to highlight here was the fact that students stated, after conducting this research, they plan to adopt a more holistic approach towards their patients and conditions that they see in practice. So this has had a longer lasting impact on students, taking on board the research that they independently conducted under my supervision and the presentations that they presented themselves, and they also heard from their peers. It's affected them in a positive way in terms of them wanting to adopt a more holistic approach. And I wanted to share with you a quote from a student that has come from one of the interviews that I conducted. So I'll give you a minute or so just to read through this, and then I'll read it through as well. So this student has said, I think I will go into practice with a much more open mind. I think it's very easy to be skeptical of things, especially like meditation, where the physiological processes haven't been confirmed and they're quite theoretical at the moment. So it would be easy to say from a scientific perspective why I wouldn't believe it would work if a patient had brought it to me as an option. So I think not just for meditation, but for all of the other traditional medicines, I would be much more happy to go ahead, perhaps after consultation with the patient and doing my own research, and then be able to get back to them with a more balanced view. So this is wonderful, where we consider the biomedical model traditionally looking at patients presenting with specific symptoms, and we just think we need to treat those symptoms individually. Now the student has, after this research, come to his own realization that he'd like to have an openness and take a more holistic approach when he is speaking with patients in practice. Okay, so enough from me. I would love to invite you to take part in an activity. And this activity is really a lovely knowledge exchange where we can hopefully learn from each other. The activity is in 3 parts, and it will involve small group discussions, but also the use of a Padlet. So let me talk you through it. So the first part of the activity, the first element I'd like you to consider in your group discussion is ideas. How do you think we can integrate the teaching of creative health within medical or healthcare student curricula? And some prompts just to help the idea juices get flowing. Could you consider in your group's methods? What methods could we do this teaching? Do we think it belongs in a didactic setting? Should it be a lecture-based assignment or set of tasks? Or could it be something done independently by students? Could it be something immersive where they go to perhaps a clinic and they speak to patients, and it's a clinic that does take a more intentionally holistic approach to patient care? The format, again, that would probably be in line with what I mentioned with methods. How would we like to teach this? Do we want patients coming in? Do we want students to look through case studies? And the themes and context are quite important as well. What themes, perhaps you're already teaching a healthcare curriculum, what themes do you feel that creative health could align with? Where do you think it would sit within your curriculum? And the context as well is very important. A lot of times students are taught things in a quite siloed way. Here's your creative health teaching. Now we'll move on to teaching of a different block and of a different body system, etc. What context do you feel that creative health teaching belongs in? Do you think it should be woven in, and how might that look? So ideas, I'd love to hear ideas from you first of all. After you've had some time to discuss ideas, I'd love you to start thinking about barriers. And I can imagine as some ideas do come up within the group, there'll already be some barriers coming up for some of us. So what do we anticipate to be the obstacles to this? So again, some prompts. Are these obstacles largely operational? Is it to do with we don't have enough resource in our institution to be able to teach creative health? We don't have enough academic staff to be able to supervise small groups, so maybe that won't work operationally. Could it be practical? A lot of the sort of resistance I hear about incorporating new teaching within curricula is we just don't have time. Is it practical? Is it that the curriculum, the timetable is already so full? Is it motivational? Is it you feel this area, creative health, won't be well received by your faculty? So interesting to discuss these barriers, and then moving on to thinking about solutions. So what we really want to do is think about how we can work to overcome these barriers. So the ideas we discussed initially for creative health teaching are visible and can be implemented in a meaningful way in undergraduate healthcare curricula. So the Padlet is available to you. There's a QR code for it as well. And I will put a link to the Padlet in the chat. We have done incredibly well for time. So I'd love to give you 15 minutes to discuss this activity, 5 minutes on ideas, 5 minutes on barriers, 5 minutes on solutions. And then we'll come back together and have a sort of 10 minutes or so discussion and then close. And please be sure, let me show you the Padlet as well, to add your ideas, barriers, solutions to the Padlet so that we can share them with each other as well afterwards. So I'll just stop sharing now. Okay, I'll pop the Padlet details in the chat. Just before you go off and conduct this activity, does anybody have any questions for me?
Yes, please, Maaya. May I?
Yes, of course.
So, like you, I'm a graduate of Faculty of Pharmacy. So
Okay.
I understand your background, but I think and actually I'm from an Eastern background. I'm from Egypt. So
Okay.
we like to use what you may now say as a creative health. For me, it was before traditional medicine, but traditional medicine is also including not only arts, cooking and crafts, but also using of herbs and other stuff. But the point is that I'm also I'm teaching at the Faculty of Pharmacy. I'm teaching pharmacology, but I think before I would think to implement such a topic in my curriculum, I have first to be sure that we have an evidence-based research about the efficacy of this tradition. Because from my experience, but not it is not a research-based topic, that it might help with some people, but not the others. So I think it will be too difficult to make it universe for everyone. We need first to have data so that we can build on that data. So what do you think?
Yes, Mike, thank you very much. These are really good points that you raised. Considering I've just finished the master's, I can certainly reassure you that there are hundreds, maybe even thousands of different studies that have been conducted on different creative health interventions. As part of my master's, I actually conducted my own study. So I produced original research into mindfulness and perinatal mental health in Black and South Asian women. And I'm presenting this next month at the Royal College of Obs and Gynae. So I want to just say that to you, not as a shout out, but more as the medical community is changing. That I'm able to go to the Royal College of Obs and Gynae and present some research on mindfulness and mental health is incredible. And the research is quite robust. It's out there. And I think you raised a really good point as to a barrier. When people come to creative health interventions, they may consider, is there enough data? Is it robust enough? Is it something that we can do? Because like you said, Mai, they work different on different people, and can be different for different people in terms of how they experience and receive some of these creative health interventions. So I think definitely raise that as a barrier in your discussion, in your breakout room. I'd also like to draw your attention to the WHO has championed a big piece of work. I'll put the link to that in the chat, which has been conducted by some of my colleagues at UCL. One is Professor Daisy Fancourt. I don't know if you've heard of her. She is very kind of known in the field of creative health. And so because the WHO has championed creative health, they've put together a complete systematic review, like you said, Maya, of lots of different studies behind different types of creative health interventions, dance, gardening, singing. And so again, the data is there, and it's whether we know how to access it and whether we can show it to our students and they can have a look through it and look through it with that critical lens as well. So you've raised really good points, Mai. Thank you. Haruka, of course, you can have access to my slides. And Viv, you've said how accessible and available are creative health interventions to patients across the UK. I will answer that when you come back. I'm mindful of the time and I would love for you all to have enough time to have these small group discussions. And so Frances, I don't know how to set up.
Yeah, I can put people into breakout rooms. Maya, we have 10 people on the call. So how many breakout rooms would you like?
2 groups of 3 and 1 group of 4? What do you think?
Sounds good.
Thank you very much, Frances. Oh, lovely to see your faces. Oh, hi, Kirsten. Hi, Viv. Hi, Mai. Welcome back. Okay, perfect. So what we thought we might do is come to you all as a group first to ask if there's anything that came from the discussions that you want to talk about, and then we'll go to the Padlet. Were there any kind of top themes that came up, any barriers that kept coming up, or any solutions that you were like, this is brilliant, every university should be doing this to teach creative health? Sorry. Anybody would like to share anything?
I'll just shout something up. Yeah, I had a really nice conversation with Michelle, who's so I'm teaching on a pharmacy course, and Michelle is teaching on a nursing course, and has previously implemented some really good arts therapy type practical experience with the students, and I'm definitely taking away some exciting ideas for essentially getting the students to try the things themselves and see kind of how they're feeling kind of towards the end of it. I don't know if I really summarized it very well, Michelle, but thanks very much. Like, I really enjoyed the conversation, and I think I've definitely got some ideas that I want to try and take away. I'm kind of looking at, could I do it as an interprofessional learning type activity? Yep. So get bigger. It's maybe overambitious, but we'll see.
No, Amy, lots of nods from the group. So we are on your team, maybe even a cross-institutional, interprofessional collaboration. Whoa. All of us go, yes.
That would be fun.
Well, we definitely probably get in the papers or something for doing something like that. A really big creative health intervention. Yeah. Wonderful that you and Michelle had such a rich discussion and that you were able to get some inspiration and some ideas to try. And I think that's another thing. We haven't really talked about it because it's not strictly in the context of creative health, but some of these creative activities, I went to a session earlier today, I don't know if some of you were there, about sketching. And when we have high-performing students who hold themselves to such a high standard, doing something like picking up a pen, if they're so used to studying pharmacy, can feel really alien. And they can feel like, oh, is this for me? Is this something to do? So Amy, like you said, like a low-pressure way of them trying it themselves and seeing for themselves if there was benefit for them might be a nice way then for them to have that sort of immersive, empathetic approach to then hearing it from patients who may arrive in their consultation saying that they're doing X, Y, and Z. Thank you, Amy. Anybody else before we go to the Padlet? Okay, I will come to the Padlet then. Thank you all so much. I am seeing some brilliant stuff on this Padlet. I'm hoping you're able to see it shortly. Okay, wonderful. Okay, oh, wonderful. Okay, so ideas. So you've discussed international cuisines, lovely, the science behind how they break down in the body to support religious practices, and also students to think about how this really is a creative health technique. Wonderful. And again, we wouldn't classically think of culinary skills, eating, cooking, to be part of creative health, and yet it is. We're often also very creative in the way that we make meals for ourselves and present dishes and things, so definitely. In nursing, how we embed gardening, yoga, mindfulness into the program for our students to try themselves. Wonderful, wonderful. Lots of ideas to sort of ruminate on. And previous experience, which I think Amy referred to, that Michelle kindly shared, of running an arts therapy clinical week with student nurses. Wonderful. Michelle, if you're happy to talk to us a little bit about that in a second, it would be lovely to hear more. I'll finish talking through the Padlet, and then if you're happy to, it would be great to hear your experiences. And then student research to build evidence base for creative health. Yes, definitely agree. The student research projects are brilliant. The National Centre for Creative Health is wonderful. It's trying to create a repository of all these different research projects. So much like Maaya said, we really do want to build up more of this bank of evidence in support of creative health interventions. So if you do choose to ask students to conduct some research projects, definitely reach out to the National Centre for Creative Health. They're called the NCCH. You'll just be able to Google them and find them, and they'll be happy to take on board a one-page, two-page overview of the research that students conducted, the research that you may have conducted. So, for example, that Creative Health Scholarly Project module research project I sent that into them to say this is the benefit of it to medical students. And my students themselves created short 1 or 2 pages and sent them across as well. So barriers, okay, let's have a chat about them. Attitudinal, clinicians still want their words to be accepted without question, no time to discuss options. Some of the attitudes are hard to shift. That's very, very true. In fact, Francis and I were discussing that as well. And we do find that people do, they're quite precious about medicine being medicine. And so certain things that are considered kind of on the fringes of medicine, like creative health practices, they can easily be dismissed. And I think that's why having some of this scientific rigor behind the evidence that supports the use of these creative health interventions means that it can't be questioned, it's irrefutable, that some of these interventions actually have shown really great benefits. So in a way, it's kind of thinking, well, if they've shown benefits, what's the resistance? And those attitudes are definitely something that we hope we can change. Regarding food, sometimes students have a difficult relationship with it. That's a very good point. And it can be difficult for them to relate. There's also issues with timings, fitting the teaching into packed modules, and having the resources to provide sessions such as yoga and meditation. These are all very, very good practical considerations. Facilitators required, time limitations, costs involved, making time in the curriculum, definitely. So you've all raised some really useful practical barriers for us to have in mind if we're considering starting some of this teaching. So solutions. Shifting the power dynamic between clinicians and patients. We hopefully, I think it's been sort of 50 years since we tried to move away from that paternalistic model to more of a patient-centered partnership between clinicians and patients. So fingers crossed, something like this, embracing something like this, creative health, would facilitate that. Asking our students who have experience of types of creative health to facilitate alongside. How wonderful. I really, really like that idea. And it reminds me of kind of decolonial practices as well, that the power dynamic that exists is I'm the teacher and you're the student, so I have all the knowledge and you're here to learn. But actually that doesn't take into consideration what experiences and knowledge the student brings to the environment. And so I really like that idea of coming to students to ask them what experiences they have, what benefits they may have experienced, what difficulties they may have experienced, and to speak about them openly if they're willing. And I agree, highlighting the evidence base for effectiveness of interventions means that we're probably going to get a lot less resistance than if we were just speaking about it anecdotally. Thank you all. I'll stop sharing so I can come back to the group again. These are brilliant insights. Thank you so much. I thought, Michelle, if you're happy to tell us just a little bit about the Arts Therapy Week, it would be so great to hear about how that went and how you designed it, maybe just a minute or two, so not too long.
Yeah, it was kind of born out of necessity, really, because it was during the pandemic time. And for those of people that don't know, the nurses need to have a certain amount of clinical hours to register at the end of their course. So we had to come up with some more sort of creative ways of fulfilling practice hours. And I'm not quite sure how it started. It was just a general conversation between, some people that were specialists. But we put this week together, and it was basically all done on Zoom. The students at that time were quite a small group. They were kind of about 30, 40. So they had one day of art therapy, one music, one dance, one drama from specialists within those fields. And then they had to do their own kind of little creative bits of follow-on work. And then at the end of the week, they had to do a presentation in small groups on Zoom, picking one of those 4 kind of themes. And it was really interesting. It was really successful because they've carried, I don't work at that university anymore, but they've carried on doing that every year now as part of the validated program. And it was just really insightful. And the students, apart from gaining knowledge on how those therapies were useful for service users, for a lot of them, it was almost therapeutic for themselves. And they learned things about themselves that they didn't realize. It kind of popped the lid off of some people to be really reflective. So yeah, it was really good. But it was quite expensive in terms of pounds and pennies. And as the cohorts got bigger, it needed more and more of ourselves to help facilitate. But it was worth it. And I was saying to Amy, we were also a new program at the time. And when you have new programs, you have the kind of benefit of being able to try new things. Whilst your cohorts are still quite small.
Yes, experimenting.
Yeah.
Thank you, Michelle, for sharing that. It's so interesting to hear that the students really took to it. And again, it feels like it's outside of their discipline, being nurses, to learn about all these arts-based interventions and therapies, and yet they really found it of value. It's so great to hear about your experiences and to hear that it can happen and it can have a really positive impact on students, but as well as the practical considerations you mentioned of the timing and the cost as well. Thank you so much. I'll go back to sharing now. Just before I do, any further questions? We're sort of wrapping up now, or any further reflections actually from the discussions? Okay, I will come back to the slides then. Okay, so thank you all so much for being so engaged in this session. I have learned so much from you, and I will definitely have a look back at the Padlet after this session as well, just to remind myself of the talking points that you've raised. And essentially, I just wanted a sort of note to end on, to share that we know that creative health can support with the evolution of the modern medical practice, the way that we practice medicine here in the West, by amplifying the patient's lived experience. And that's because it considers the patient's emotional, social, and spiritual life, as well as their physical health. The current biomedical model, as we said, is quite limited in seeing the patient's symptoms, but creative health practices start thinking of the patient as a person. And so integrating creative health teaching into the healthcare student curricula is an important consideration, something we've discussed today. And as I've mentioned, this session may have started conversations, and I'm hoping those conversations will continue, that this knowledge exchange can happen, that if some of us do go off and experiment with certain techniques, certain teaching methods, that we can come back and speak about them with each other and continue that kind of knowledge exchange in these conversations, and potentially result in meaningful outcomes in terms of having some teaching visible, meaningful teaching visible on our timetable for our students. And the Padlet will be available to you as well after the session, so it's always there for you to refer back to if you'd like to. These are the references associated with the slides. Thank you so much, everyone. Feel free to reach out to me, as I've said here, to keep the conversation going. My email address is there. It would be so lovely to hear from you if you do choose to pilot anything. If you'd like to sort of bounce any ideas, I'm here, I'm available. It would be lovely to meet any of you who might be based in London to talk about this in person, if we can. But this has been a really lovely session and a really rich discussion. So thank you all so much. I'll stop sharing now and come back to the group.
Thank you.
You're welcome, Francis. I was just going to say, any final thoughts, anything anybody might want to add, questions?
Thank you very much. It was really fun. So I'll get in touch with you.
Thank you, Erika. Thank you. I'll put my email address in the chat.
Yes.
Thanks everybody for coming along today. I think we've had a really, really interesting talk, and feel to thank Maaya very, very much. Wish you luck with your presentation next month. And it's really, really good that you're widening the message and getting the conversation spread. And I hope to see this becoming more mainstream in the future. So I have just popped a link in the chat, 2025 Global Festival of Active Learning, Celebrating Learning and Participation. So that's a link to the feedback form. So if you would leave some feedback for Maaya, please. You can also select what sessions you've been to. So if you've been to other sessions during the week and you'd like to leave feedback for them too, that would be great. And thank you all for coming along. Our final talk and closing ceremony is in 2 hours' time. So I hope to see some of you at that. Thank you very much.
Thank you, everyone. Have a lovely afternoon. Bye. Thank you, Francis.
Thank you.